Implants are a well-known and efficient solution to replace missing teeth. Implant dental treatment involves two major phases, osseointegration as well as final restoration. In this short video, we'll discuss the two phases in depth and what they do to the effectiveness of dental implants. Osseointegration is an essential process for implant dentistry where the implant is fused to the jawbone. This is crucial for the stability and longevity for the implants. In osseointegration, the dental implant is surgically inserted into the jawbone where it acts as the root of the tooth that is missing. The jawbone grows around the implant, forming an extremely strong bond between the implant and bone. The effectiveness of osseointegration is contingent on a variety of factors, such as the quantity and quality of jawbones, as well as the expertise of the dentist and the overall health of the patient. Healthy gums with adequate bone density will have a greater chance of experiencing an osseointegration process that is successful. It is essential that patients maintain proper dental hygiene and to follow dental professionals' recommendations throughout the healing process in order to encourage osseointegration. Once the process of osseointegration is completed, the restoration process commences. In this stage, dental professionals attach an abutment onto the implant and then places the crown over it. The abutment acts as a connector part that joins the implant and the crown. The crown is the part visible of the implant, which is reminiscent of a real tooth. The last stage of restoration is essential to achieve an aesthetic and practical outcome. Dental professionals will ensure that the crown matches the shape, color, and the size of the crown with the existing teeth of the patient to create in unison. The crown is made to fit the mouth of the patient perfect and offer the best comfort and functionality. Patients are required to adhere to the instructions of their dentist following the restoration process to ensure the longevity and health for the implants. Regular checkups of the dental health and hygiene are vital to monitor the condition of the implant as well as the surrounding tissue. Patients must also adhere to good dental hygiene practices, including brushing their teeth regularly and flossing, to avoid complications and guarantee the longevity of the implant. The process of implant dentistry consists of two major steps that are osseointegration and the final restoration. The process of osseointegration occurs when the implant joins with the jawbone to create a solid base to support the implants. The last stage of restoration is the attachment of the abutment and the crown onto the implant, giving a natural and practical outcome. Patients are required to adhere to the instructions of their dentist and follow good dental hygiene practices to guarantee the successful operation of their dental implants. Implants are a long-term replacement for missing teeth. They can also significantly improve the look and functionality of one's smile.